For Stanford Healthcare and Stanford Hospital, the voices of the community really became an incredible engagement tool in so many different venues.
We went out to the schools, to community events, to senior centers. We were out at the shopping center. We spent several days at both the hospital here in Palo Alto as well as hospitals around the Bay Area to engage staff as well in the process of really being able to voice their feelings about what health and wellness means to them.
This project really gave people in the community an opportunity to share their views and their vision in a way that's a little bit different than trying to have to articulate the right words.
It's the expressions of love and support that the community members have for those who work here and for the healing that goes on here each and every day.
In my artwork, I drew the ocean, and especially a big wave in the middle, because I draw a lot of energy and happiness from being in the water.
Being part of the mosaic, I feel that I am able to be part of a larger, good, shared experience that lies behind the creation of the hospital and the efforts.
When people see the mosaic, I hope that they can step outside of their lives and see the bigger picture of what patients and the family members and friends of the patients are going through on a daily basis.
And so when it's all put together, I'm hoping that this will give other people a sense of hope and a sense of joy and a sense of community.
Stanford is here for everyone, that there's not one person that it's not here for, and everyone has a place in the community, and the community supports Stanford, and the Stanford supports the community.
We were really able to hear the things that they were saying in the messages they wrote in their submissions and their artworks, and how much they cared.
I thought it was really wonderful that all of my students could participate in this project together. We had common language, a common theme. We were building something beautiful for the community, and each student could share their story, their voice, their ideas, and I thought it was really powerful that we could all work together.
I wrote words and phrases that I thought were important, such as trust. I thought that there should be more trust in the world, and happiness and kindness.
I wrote voices because it means voices to the community.
I did my artwork because I wanted to have a voice too.
The mosaic is a picture of many people working together to help the people who need help, who need encouragement, who need friends.
Being part of the mosaic makes me feel important, and I want everyone to know who comes into hospital that I care and we care about the community.
I wanted to do something that highlighted volunteers, and what we offer is sharing, peace, joy, hope, care, being present.
Each of the flowers represent different patients at the Stanford Hospital. The sun is like the beautiful sunlight that comes through the building and all of the wonderful architecture and artwork. The water is like all the different necessities and the environment patients get to stay in. And most importantly, the care for them is all of the nurses and doctors at Stanford Hospital helping them.
So Stanford is pretty much like a foundation, and the branches spread out all these words that what it represents and what it stands for.
Voices of the community means to me that many people put their thoughts as to what Stanford represents to them, and they all seem to have a common message of working together in improving healthcare.
It's just really a representation of how we all together as one community, although we may have different colors, different shapes, different images, different drawings, different life experiences, when we come together, we can become something really beautiful.
It really did deliver on what we wanted to be able to share with our community. Whether you're looking at school kids that were involved in this, whether you're looking at our own employees, or even when you looked at the CEO who had his own, and Voices of the Community became that tool for us to bring individuals in that we may have not touched before.
It was creative, it was joyous, it was engaging in a way that I don't think we normally get to do with our community and our staff members. It was personal in that we really were privileged to have people share with us their personal feelings about the hospital and the caregivers there. So I would say in the end, if I had to sum it up, it was really, really fulfilling.
When all of us saw the mosaic, it was wow. It had finally come together, and I think there were moments we got a little choked up when we finally saw all the expressions of love and support from the community. It was a pretty special moment.